And let's be clear, there is no evidence to suggest that Connecticut is in any way connected to this scandal. New York is being accused of undercounting nursing home deaths by not counting nursing home residents who died in the hospital. The FBI is investigating New York Governor Andrew Cuomo for allegedly undercounting nursing home COVID deaths. Here in Connecticut, former Republican congressional candidate Margaret Stryker tweeted that she's calling on the state attorney general's office to audit Connecticut's death figures.
And that we do peek behind the curtain and hold anyone accountable if there is something. I am not saying there's something. I think we just have a obligation to the integrity of what's happened here.
In a statement, the Attorney General's office said, in Connecticut, the starting point for a complaint of this nature would be the Office of the Public Auditors. Complaints by residents or on behalf of residents regarding long-term care may also be directed to the Connecticut Long-Term Care Ombudsman Program. The leading voices on the recovery of Connecticut's long-term care industry told Fox 61 the numbers are accurate.
From the beginning of the pandemic, we've included deaths that occurred both at the nursing home as well as nursing home patients who were transferred out to the hospital and subsequently passed away at the hospital.
That fatality would be reported in Connecticut as a nursing home fatality, not a hospital fatality.
Since the start of the pandemic, Connecticut has lost 7,449 souls. Upwards of 70% of them are residents of the long-term care setting. The deaths may not be exact.
It was really just confusion in the early part of the pandemic.
You may remember that at the beginning of the pandemic, before testing was widely available, the Office of Connecticut's Chief Medical Examiner, an independent agency, would sometimes not be able to determine if a death was from COVID. So once a reporting system was set up, the state had to go back and retroactively add them to the tally.
About 1,000 death certificates were actually amended to classify them as COVID-related, and we're only one of about 9 or 10 states in the nation who include in our death totals probable COVID deaths.
The state of New York is also being accused of exacerbating the spread of COVID in nursing homes by forcing them to accept COVID-positive discharges from hospitals, something Connecticut did not do.
Connecticut had the forethought to better understand that quarantining of COVID-positive residents and the very vulnerable patients that we care for in nursing homes was essential right from the get-go.
Worried about hospitals reaching capacity, Athena Healthcare and the Connecticut Association of Healthcare Facilities instead proposed standing up COVID recovery centers, which later became a model program for cohorting.
I think we were able to demonstrate that it would have been the wrong direction to mandate nursing home admissions from hospitals, both when the COVID status was specifically known, but also when it was unknown due to the lack of testing.
And while Connecticut is confident in their nursing home death numbers, an independent agency called Mathematica was still hired following the first wave to assess the COVID outbreak, state response, and make recommendations. And now back to those COVID recovery centers. Some good news to report. 2 of them are closing down. The COVID recovery homes in Torrington and Meriden are no longer needed because the infection rate has dropped so low. Since October, they have helped about 300 Connecticut residents recover from the virus. Reporting in Hartford, outside the state capitol, Matt Caron, Fox 61 News.